We have all heard horror stories about the cost of emergency room care, but listen to this, a bill of $2,300 just to treat a bug bite.
The Centennial father reached out to Contact 7 after he got that bill and then tried to dispute it. Denver 7's Lance Hernandez is asking Centura Health, why so much?
When we got that bill, we were just astounded.
Call it an expensive bug bite. Jasmine Pine got bit on the leg last June. It became infected.
And we called Ask a Nurse.
They told her to get it checked, but she didn't get off work until 11 p.m. and the urgent care centers were closed. So she went to Littleton Adventist.
We already marked it with a marker, but they did it again with more of a permanent marker to check the swelling.
The bill for $2,397 came in the mail.
A bill of $400 or $500 might have been more in order, but $2,300 to look at a bug bite, draw a circle around it, and then give her antibiotics and say go home? Come on.
Centura Health says ERs are expensive because they're open 24 hours a day and are staffed with doctors that can handle a wide range of emergent conditions. The Pines disputed the charges, and we asked if they could get a break. But the hospital won't relent.
The emergency room has effectively become the unencumbered profit center for the hospital systems.
Seth Denson, a risk management expert at GDP Advisors, says healthcare systems are restructuring how they bill and how they staff ERs. Many hiring staff that are not in network, which can cost you more.
Hospital systems are incentivized to run more tests, to check more things.
In part to avoid litigation, but also for the bottom line. He says consumers should do their homework, ask if the test is necessary, and whether the doctor is in network.
If they say they don't know, then say, I'd like you to hold off seeing me until you can verify whether or not you are.
No one has explained that.
Lance Hernandez, Denver 7.
And higher drug prices, not just a Colorado issue. According to a new report, hospitals across the country are marking up drug prices by as much as 700%.
So out of the 3,800 hospitals studied, 1 in 12 charged 1,000% more for the drugs than they paid for the drugs. The American Hospital Association says the drug industry is just using this study to distract from its own price hikes. If you ever have a tip, anything you want us to look into, like the rising price of drugs here, email us please, contact7@thedenverchannel.com.